Hi, no, it's Jennifer Doggett here at the National Rural Health Scientific Symposium, and I'm here with Professor John Wakerman, who's just spoken at a really interesting session looking at rural health research and progress in implementing that. And I just wanted to ask you, John, to comment on the fact that one of the messages that I took away from that is that there seems to be a bit of a different view within the community as to whether we should be looking at really transformational change or incremental change. Is that true? And what were your views on that?
Look, I had a sense from the group here that that attended our session that they were pretty much ready for transformational change. It's been quite some time now, in the late 90s, since the last sort of transformational change for rural health. And I just got a sense that people were ready for it. We have a lot of research evidence that would guide us in terms of health system development across rural and remote areas. So I think, at least in that audience, which were researchers and rural health professionals and so forth, that there is an appetite for change and appetite for change at a transformational level.
Great. And what would you say to the Health Minister if he were here, and if indeed he does listen to this, about that need for systematic generational change in rural health?
Look, I would say we're very appreciative of the really fantastic developments in rural health around the country over the last 20 years. I think that the academic infrastructure that we have in rural and remote areas, how we work very closely with health services on the ground to ensure that training is appropriate, to ensure that the research, the health services and workforce research we do is useful to those services. I think we've got a lot to be very proud of, and I think that infrastructure is the envy of the world, in fact. What that has produced is not only a workforce, but also a whole lot of evidence about how health systems can be improved. And so what I would say to the Minister is, we think that we can do it better. We've got a good health system now. We think we can do it better, and we can get you better health outcomes at a lower cost. And if that's a bargain, no one can resist.
Absolutely.